How many times can you take Accutane? That's the question that we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute. And as many of you know, we're a very unique dermatology practice. We only treat acne. We specialize only in the treatment of acne. So we have certain unique observations and experiences that we like to share with people who are suffering with acne and trying to navigate the path toward clear skin. So we hope you find this information useful and educational, but remember, it is not for medical advice. It's just for educational value. A common question that comes up at Advanced Acne Institute with my patients is how many times can they take Accutane? So sometimes a patient has already taken Accutane once in the past and they did well, but then their acne came back and they want to know, can they take it again? And the answer is some people do end up taking Accutane more than once. Now, thankfully, the majority of patients typically do well after taking Accutane one time and they don't need to take Accutane again. However, there is a certain percentage of patients that end up taking Accutane again. And that's because every patient is different. Like we always talk about, in acne treatment, there's not a one-size-fits-all treatment. So some patients do well with one type of treatment, others do well with another type of treatment. And even within those treatments, patients have different responses. And sometimes patients relapse. So even with Accutane, which has the highest rate of making acne go away, within Accutane, there is still a group of patients that either don't respond well or respond well, but then eventually acne comes back. And that could be a month later, it could be 3 months later, it could be 3 years later. So for those patients, they do have the ability to take Accutane again. And sometimes we modify the way we treat with Accutane, depending on the dose that they took the first time, depending on how they responded, depending on what potential side effects may have happened. We might modify the way we give it the second time. But overall, it is a medicine that sometimes does get used more than once, and sometimes it takes more than one treatment until a patient has a satisfactory or successful response without having significant acne breakouts come back again.